Hey everybody, it's Bryan Docobo here. I'm the father of two children that have been diagnosed with Coates Plus syndrome. Coates Plus syndrome is a disease, a genetic disease that is caused by a mutation in the CTC1 um, gene. That gene plays a role in the regulation of telomeres. Um, when that occurs in the body, it's a horrible disease. Leads to several different issues throughout the body of the patients. Um, while there's not while we don't know the causation, there's a correlation between telomere diseases and vascular issues. The purpose of this video is for me to kind of explain just a brief pathology of the disease and how it manifests, so we can find a way to attack it. All right. So as we discussed, it's a genetic disease. So over here, if we're talking about upstream of the pathology and downstream, um, over to this side, the more upstream that you can solve a problem, more of the root cause, if you will, the more it can have a broader effect in the scope of the outcome. Okay. Of course, when we're battling the disease, we'll take as much as we can where we can to battle this. So anyhow, if we're going to have an origin source, obviously the origin source here is the genes. There is a lot of work being done, and we're in a great time as far as um, a lot of growth in gene editing, gene augmentation. There's plenty of groups that are tackling that. That has to do more with uh, the technology as opposed to the specific gene. Our foundation isn't necessarily focused on that because as it's the technology and there's so much money being put forth there, we don't think that it's the best use of our resources also trying to battle at that stage. But we are locked in and tune with those communities that are working towards conquering that particular component and advancing that technology, as that could be a big win, not just for this disease, but all diseases, cancers. It's going to be a landmark day when they figure that out. Great movie on this, or great company to take a look at in this regard is CRISPR. I'm not going to discuss CRISPR in detail here. We can have a discussion about that another time, but there's other great resources out there better than mine. While I'm, not promoting any particular documentary or science behind it, as it's ever changing, to get a bare bones basic understanding of gene augmentation and gene um, editing, I would suggest taking a look at a documentary called Human Nature. It's on Netflix. Again, the name of that is Human Nature. It gives you a very fascinating insight to where they're at. We are a bit of a long ways off, but nowadays things happen very quickly, and things they just turn that corner, and then all of a sudden it could explode. And believe me, we are very, very interested in seeing the development of that technology. Anyhow, farther up the pathology, we know it's a mutation, the CTC1 gene. And again, while we don't know, and it affects specifically telomeres. Telomeres, you could do a little research on that as well. Telomeres, I didn't know what a telomere was just a few months ago, but obviously once my kids were diagnosed, I had to learn what a telomere was. From my understanding, a telomere is what caps our DNA. I don't have my mind fully wrapped around like a scientist. I'm sure there's other areas out there to go out there and kind of figure that out. But it is a very important function within the body. And as far as telomeres are concerned, the specific gene, the CTC1, works in the telomere. It regulates what's called telomerase, a certain substance that is needed for the function of the telomere. And there's a dysfunction there, which leads to a lot of problems. So let me give you just a brief talk about telomeres, or just really the cellular structure of the body. As you know, every day we have a whole bunch of cells that die off. I don't know if it's millions or billions or trillions, but I know it's a lot. So we have cells constantly dying off, and our body is constantly regenerating itself. And what our cells do is they divide. They divide, create additional cells, and through that process, the telomere gets shorter and shorter. All right. Um, you'll see some gurus nowadays talking about telomeres, saying if we could crack this code, we could solve the um, crack the code of aging, and this can be some sort of fountain of youth. It's really fascinating stuff, and the belief is that this is what leads to the aging process. The cells are not as good in the next generation, and so on and so forth. Leads to wrinkles and the body not working as well. But with our children, having a dysfunction there obviously is creates more rapid depreciation of those cells and leads to other problems. So anyhow, that's briefly what telomeres are. Again, I'm not a scientist. I'm not a doctor. This was not the path I took in school, but I'm here now, and I'm just doing the best I can as a father. Anyhow, the telomeres lead to a little farther down the pathology. While there's a correlation, we don't understand the causation. That's part of the science and research that we have to do in our foundation. But there is a manifestation of vascular issues, and these are pretty substantial. We're going to get to this in more detail on the next slide, because this is really how the disease is founded, or based on these vascular issues. The typical story is, well, the babies are born prematurely, low birth weight, growth retardation. Ultimately, my oldest son was 2 pounds, 12 ounces. My youngest was 1 pound, 7 ounces. Oldest was born at 34 weeks. The youngest was born at 27 weeks. Come to find out that it's the baby's DNA that also creates the placenta. And based on having that dysfunction in the placenta, we have a pretty strong hypothesis as to why there's those birthing issues. Because as the placenta is generated, it's a rapid division of cells to create that organ. Our story is that we had a abnormally small placenta. One hallmark seems like 80 to 90% of the patients is low amniotic fluid. But regardless, there seems to be across the board some sort of placental dysfunction, which leads to those birthing issues here along this way. Anyhow, so because it's such a rare disease, it's not put together at that juncture of that this is Coates plus syndrome. They just said, we were told this is an aberration, this will never happen again. But this is, they didn't know. It wasn't until my oldest son had a seizure at 4 years old that we discovered on an incidental finding on the MRI that there was calcifications and cysts in his brain. Seems to be how a lot of people discover this disease is based on that MRI, as it appears to be some sort of infectious disease or some other manifestation. A lot of times it's misdiagnosed. Matter of fact, our youngest son, Ethan, had eye issues, similar to retinopathy of prematurity, but it wasn't that, but they treated it like it was ROP. And a lot of times, because they have to do an angiogram to really see the eye and the damage being created, a lot of times that is missed, which is what happened to us. And we caught it at a later stage with Ethan. We had to have a bunch of eye surgeries. Really quite horrible. But people's parents with these children with this disease, it starts coming on our radar with the eye manifestations and the brain manifestations. But the question is why? Why are there calcifications and cysts? Why are we having these eye issues? Well, the reason is the vascular component to this disease. So it's bad angiogenesis, and for a more novice term, it's bad blood vessels that leak throughout the body. Okay? This disease is a multi-system disease. So those bad blood vessels in the eyes, for instance, leads to swelling in the eye, could lead to retinal detachment. As it's discovered, they treat it like ROP and they battle it. But that's why it manifests in the eyes. It's actually the bad blood vessels. In the environment of the brain, those bad blood vessels lead to a calcification process and cysts forming in the brain, which creates leukodystrophy and cognitive decline. Ultimately, when we saw that on the MRI, it's quite impressive in a bad way. These types of diseases. We were told by the gentleman, or doctor, I should say, that coined these terms, Dr. Yannick Crowd of the United Kingdom, that when you're looking at an MRI with Coates Plus, and also another disease called Lebrun syndrome, LCC for short, you know you're looking at Coates Plus and LCC. There's nothing else really that kind of appears like it. So that's what we discovered in our story. It was like a fire alarm went off, and all the doctors ran all these tests, and then the genetic test came back a positive hit for CTC1, and that's how we discovered it. Well, these vascular issues are quite awful. They lead to other issues in the body, GI tract bleeding in children in their teens. It leads to hypertension, which could cause liver failure, and that seems to be a lot of the terminal issues are affected by these vascular issues in those multiple organs. Obviously, seeing the children degenerate is a pretty tough situation. But anyhow, if there's a way to solve those vascular issues, it's a big win. It's not going to solve the whole disease, but it's a big win. All right. Next here, and again, we're getting to a little bit more on the vascular issues in the next slide, but I kind of covered a little bit here. Next we have is the bone marrow. There are bone marrow issues with this particular disease. There seems to be, even though this isn't how necessarily bone marrow works, but and I'm going to get to the next slide when we start discussing some potential treatments. But there might be a way to kind of help the bone marrow issue by use of a drug that actually helps the vascular issues. But we just need more research and we need more funding to kind of explore that. But as the cells get worse and worse over the generations of cells, continuously dividing, leads to bone marrow issues and also malignancy. As those cells become worse and worse, you could have a mutation that leads to cancer, or the cells just aren't healthy, not even healthy enough they're dead. They just no longer work, and leads to some pretty awful stuff. But anyhow, let's move to the next slide. Okay, this is just an expansion of the vascular issues because it is a track that has pretty significant reach. Now, there's other telomere diseases out there, and as it's been described to me, if this was a Venn diagram, even Coates Plus is kind of on the outskirts of those telomere diseases, but there's some overlap, of course. And a lot of the work that we're doing with the foundation isn't just going to be good for Coates Plus patients. It also is going to be a lot of fantastic research when it comes to other telomere diseases. And there's two foundations out there that have been fantastic and been a huge support to us as our family and the other children with Coates Plus. They are DC Action. That's an international group based primarily out of the United Kingdom and now New Zealand. And then you also have Team Telomere, which is stateside. It's based in the United States. Both those organizations have gone over and beyond for our children as well as the other Coates Plus children, and they're fantastic organizations to work with. Through our foundation, we're looking to expand their research potential along with some other scientists and researchers that we have our eye on, but we're looking to kind of, turbocharge those institutions as they already have a pretty good infrastructure in place to procure some good results for the children suffering of this disease. So anyhow, this is the vascular issue. As we discussed, there's malformed blood vessels, the bad angiogenesis, if you will. Those bad blood vessels lead to problems in the eyes, as we discussed, problems in the brain with the calcifications and cysts. They also appear in the esophagus and the GI tract. As we also discussed, the vascular issues lead to portal hypertension. The portal hypertension affects the liver, lungs, and spleen. It's a multiple system. Now, let's talk about some positive news. Positive news is this. There is a drug called Avastin that is that's kind of the specific name of the drug, but it falls under an umbrella of drugs. I think it's Here we go. Sorry, I had to look it up real quick. Yeah, they're called VEGF, anti-VEGF drugs. Okay. Um, anti-VEGF drugs stops those bad blood vessels from occurring throughout the body, and there have been studies that show there was actually another disease called Lebrun syndrome that I mentioned a little bit earlier. They used to think Lebrun syndrome and Coats Plus were the very same disease, but it was in 2012 that it was discovered it was two separate genetic mutations. Lebrun syndrome just affects the brain, whereas Coats Plus affects the multiple systems of the body. Well, yeah, there was a study where these anti-VEGF drugs, specifically, I believe Avastin was used in that study, where there were some very nice results. 6 months into using the drug, the calcification process stopped in the brain, and several of the cysts in the brain actually went away that didn't harden over. So that tells us that the bleeding stopped in the brain. And likewise, through our group that we have formed in the last 6 months, there is a patient that is using Avastin that specifically has Coats Plus syndrome. The first patient with Coats Plus that has used this strategy to battle the disease. There was previously bleeding in the GI tract that has gone away, and the drug's being used to battle the disease with them and keep them alive. So there's a lot of we're still studying this and monitoring this. My children are going to be given the drug tomorrow. In fact, we're pretty excited about it. And there's another child that is getting the drug not too far from us, and they've already seen some positive reaction to it. And we're very hopeful that this can be a cure for those vascular issues of the particular disease. Now, of course, that just solves the vascular tract, or we're hoping it does, but that's a big deal. Let me tell you something right now. That is a big deal if we could solve these vascular issues. Buys us more time to figure out the rest. Now, something with telomere disease, I'm going to go back just one slide here. If I can go back a slide. Hold on a second. Is that this bone marrow issue. A lot of individuals that have other telomere diseases don't have the vascular issues that Coats Plus has, and eventually their disease manifests more in a bone marrow failure. A lot of the children with Coats Plus never really kind of get to that juncture because the vascular issues, quite frankly, get them beforehand. But if we're able to capture and conquer the vascular issues, and we buy us more time, then hey, we could have some research, and that isn't going to just help our disease, but other diseases that are related to bone marrow failure. And wouldn't that be a great thing to figure out? Anyhow, but this is part of our battle. This is obviously a cause that we care much about. And if I could leave just one thought with this, any parent that's out there that has a concern that your child suffers from this disease, or similar, telomere disease, or one that has similar manifestations, or any type of rare disease for that matter, reach out to me. There is strength in numbers, and I know as a parent you could be very scared. I get that, and it's a time though to be courageous, and we are starting a movement that can lead to a lot of great things, and hopefully we can improve the quality of our children's life, extend their life, and maybe even solve this. And if that could happen, and we could affect so many others, that would be a beautiful thing. Just as much as your family may need a group like ours, our group also needs parents like you, and to connect all the children and connect them with the scientists to push this forward. You're doing something, and you're part of something bigger than yourself. This is a club that no one asked to be part of, but we're here now, and we have to be here for each other. Much love. My name's Bryan Docobo. This is a Coates Plus Syndrome talk, probably the first of many. Again, feel free to reach out to me personally. Oh, our got to plug our Facebook group. Facebook group is Coates Plus Syndrome. If you just go on Facebook and look it up, you'll find our group. Easy to connect with me on there. I encourage you to do it. Thank you for listening.